Hi, I'm Dr. Stephen Struck. I'm a board-certified Stanford-trained plastic surgeon in Atherton, California. I wanted to introduce you to our practice. This is our Atherton office. We also have offices in Los Gatos and Morgan Hill. We're illustrating the Struck Complete Laser Facelift here. This is Karen, my fiance. We're actually the team that does the surgical procedures together. We're going to use her as our model of how the consultations go and also how I do the procedure. First thing I think of with Incision is, where do you place it? You want to place these as hidden as possible. I like to hug the ear. I hug right on here. I come inside here. You want to hide that in here. Some people will do a pre-tragal incision, it's called up here, but you can see that. I like to hide it right here. I like to hug the earlobe. I like to not create an earlobe deformity. Hers is perfect, it hangs. Some people, if you pull real tight right here, you actually pull the ear forward and attach it like that, and that's a giveaway of a facelift. As you can tell, I try to focus on hidden incisions, natural results. In the back, I get right on the ear here so that when you wear your hair up or any way, you're not going to see it. I like to get right up behind the ear. That's our incision point. After I've made our incisions, I lift the skin into about right here on the cheek, all the way in on the neck. In the cheek, I find the smaz right under here, that superficial muscular aponeurotic system. I put some stitches right here in this smaz to lift like this. Hers is nicely lifted. She doesn't need one, but it shows how I lift that jowl right there. That's what the smaz stitch does. You want a smaz stitch inside because if you count on only the skin to lift, your facelift is going to last about 9 months to a year. So I like to reposition the jowl with the smaz stitch. I like to reposition the neck. A lot of people will have hanging skin here. They'll have the turkey neck, which is those two bands of muscle. That's actually your platysma muscle, which is a very thin muscle. It's about this wide. The very front of it's about right here. So I come in, I lift all the skin off that platysma, and I sew those turkey bands together in the midline with a small incision right here. So our only incision is here and here. I find those bands and I sew those together. I weaken that muscle a little bit too, so you don't get those turkey bands. That's why I work on those. Finally, I set the neck foundation by weaving a stitch all the way across like this from side to side. That pulls up like this. So internally, I've lifted the neck. Internally, I've lifted the cheek. Then I just remove the excess skin and close that. Those are the essential points of a facelift. Smaz lift, platysma lift, skin removal. That will address your jowl. That will address hanging skin. That will address bands in this region. Final point, sometimes I just simply do that procedure. Sometimes people have aging around the mouth. They have wrinkles around the mouth. How do you treat that? A facelift isn't going to change that. You can't pull hard enough from back here to work on the mouth, and if you do, you're going to make people look funny, which most patients don't want anyway. So around the mouth, I'll often laser to treat those fine lines. I'll often fat graft to fill right here and here to fill that line. I'll fat graft the lips to give volume. Many of my patients at least will want the natural look, and they'll say, don't make me look like a movie star with the big full lips or any of that. So I put a moderate amount of fat in there. I'll often fat graft the cheek as well to give them nice cheek volume. So we laser around the mouth, fill with fat here, fill with fat here. The final group is someone who has kind of photo damage all over their face. That's the group where I will combine the lift with the laser, and I'll laser the entire face at the same time as the lift. That's a procedure that I've described and presented at the American Society of Plastic Surgeons meeting. It's being published in our journals. It's a very good procedure. What I love about that procedure is the laser tightens the neck skin in the middle where the facelift can't get to it. It tightens the neck skin in here, tightens your forehead skin. So I look at that as a complete facial rejuvenation. Laser facelift, combining a facelift with simultaneous laser resurfacing of the entire face, neck, and chest. So those are the high points of the surgical procedure and how it's done. So the three key components to this procedure are, first the facelift, which lifts the jowls, lifts the necks, lifts the hanging structures, because those hanging structures can't be treated with a laser. The next component is fat grafting. I fat graft around the mouth, the lips, the cheekbones to revolumize the face. There have been a number of MRI-based studies that have actually shown scientifically that we lose fat as we age. Our faces look more hollow. That's why our skin hangs. So the second component is to revolumize the face, mainly around the lips, mouth, and cheek area. And the final component is to resurface the face with the laser. The resurfacing treats the fine lines, photo damage. I treat the entire face, I treat the neck, I treat the chest, I treat the hands. So therefore, in the end, we have a structurally youthful face that we've created with the facelift and youthful, healthy skin over the top of it. Everything matches, everything is in harmony. Therefore, I call it a complete facelift. We do offer free consultation here at Struck Plastic Surgery. If you found some things interesting during these videos, come in for a consultation. We can individualize your treatment plan to your needs, spend some time together, find out what your needs are, and create the perfect plan for you. Thank you.